Hi, I'm Dr. Iris Feinberg. On behalf of my colleagues at the Prevention Research Center, it's my pleasure to present our findings from a recent community needs assessment. As the coronavirus pandemic began to spread in early March, our community partners reached out and asked if we could do a needs analysis in Clarkston. Using both phone and web-based surveys, we collected data from 179 individuals during April and May of 2020, which provided us with information on the impact of the pandemic and helped our community partners understand the areas of highest need. We reached 179 people either by phone or through a web survey. Just under 3/4 of our respondents self-identified as refugee or asylee. The remaining 28% self-identified as non-refugee. On average, refugee families are larger and have more children. Median household size was larger among refugees at 5 than non-refugees at 3. Refugee households also had a larger median number of children under the age of 18. There is a lot of financial insecurity in the community. Almost 3/4 of refugees and over half of non-refugees report losing income due to the pandemic. We asked if people knew where to get benefits to help with living expenses. Slightly more than half of refugee respondents said that they knew where to go to get benefits like unemployment and food assistance versus 2/3 of non-refugee respondents. 43% of refugee respondents said that they would be able to pay rent, utilities, and regular bills this month, which means that 57%, or more than half, are not able to pay for these expenses. Of the 57% who are not able to pay these expenses, about half said no, they definitely couldn't, and the other half said I don't know. Compared to refugees, more non-refugees said they would be able to pay these expenses. Compared to the current month, the proportion of people who thought that they could pay their rent, utilities, and regular bills next month was higher for both refugee and non-refugee respondents. We were interested in knowing if people were able to provide enough food for their family this or next week. These data were collected before DeKalb County provided free food in the community. Just over half of refugee respondents are able to provide food for their families this week. That drops in half to just over 1/4 for the next week. For non-refugee respondents, over 80% said they were able to provide food for their families this week, and that drops just slightly to 75% for the next week. We also learned that about 1/4 of refugees report getting food from a food bank, compared with only 10% for non-refugees. We wanted to find out more about school-age children. 2/3 of refugee respondents had children in school, compared to slightly less than half of non-refugee respondents. A greater proportion of refugee respondents received free school lunch or school bus stop food drop-offs than did non-refugee respondents. Most of the children are school age and doing schoolwork at home. 97 refugee respondents said they have children at home, and 88% of those children were doing schoolwork at home. 24 non-refugee respondents reported having children at home, and 80% of those children were doing schoolwork at home. We wanted to know more about digital access. Just about everyone has access to the internet. Out of all the respondents, only 21 people did not have internet access. Just over 2/3 of refugee respondents reported having a laptop, tablet, or computer, compared with 88% of non-refugee respondents. And among those who did have a digital device, almost all of them were connected to the internet. We asked about anxiety and feeling safe at home. We wanted to know if people felt more scared, anxious, or worried in the last 7 days. About 60% of all respondents answered yes. 3/4 of refugee respondents reported feeling safe at home versus 88% of non-refugee respondents. We also wanted to know about health and healthcare during this pandemic. Very few respondents reported COVID-19 symptoms, such as fever, cough, or shortness of breath. Almost all respondents reported knowing what coronavirus is. 60% of refugee respondents reported knowing where to go if they were sick versus 82% of non-refugee respondents. 3/4 of refugee respondents reported being able to get the medicine they or their family need, compared with almost 90% of non-refugee respondents. Unlike the other questions, respondents could select more than one answer to where they get information on the coronavirus. 66% of refugee respondents reported getting coronavirus information from friends, compared with 61% of non-refugee respondents. Just under half of refugee respondents said they got coronavirus information from family, compared with slightly over half, 57%, of non-refugee respondents. About the same proportion of refugees and non-refugees reported getting coronavirus information from television, and that's just over 50%. 46% of refugees said they got coronavirus information from the internet, as opposed to 63% of the non-refugee respondents. And finally, only 16% of refugees said they got coronavirus information from a doctor or nurse, compared with 29% of non-refugees. This question also had a check all that apply format. Almost everyone reported cleaning their hands often. Fewer people overall reported that they avoid touching their face. 64% of refugees selected this response, compared with 78% of non-refugees. Many people reported avoiding close contact with others. 85% of refugee respondents selected this response, as opposed to almost all of the non-refugee respondents. With regard to staying home if you were sick, 77% of refugees reported staying home, compared with 82% of non-refugees. About the same proportion of refugees and non-refugees reported wearing face masks if sick to protect against coronavirus. And finally, 72% of refugee respondents reported cleaning or disinfecting surfaces to protect against coronavirus, compared with 82% of non-refugee respondents. Almost everyone reported practicing social distancing. It is, of course, possible that people are just telling the researchers what we want to hear, but this high proportion is encouraging. On to our key findings. Our first two key findings relate to financial insecurity, food insecurity, and healthcare access. These needs are particularly urgent for all of our respondents. While more refugees report having trouble meeting these basic needs, non-refugees are struggling as well. Refugees tend to have larger households with more children in school. For both refugee and non-refugee respondents who have children in school, we found that about 25% do not have the appropriate digital technology at home to do schoolwork. This is particularly troubling because schools have been closed since March, and students have been expected to do their work online at home using digital technology. Without appropriate digital access, these children will be left behind academically. And finally, there is a great deal of anxiety and worry in the community overall, with an additional 1/4 of refugee respondents also saying they don't feel safe at home. Regarding the coronavirus and COVID-19 safety, most respondents report following safety protocols, although observation of people in Clarkston may show otherwise. That is, people in general are not wearing masks or social distancing. Thank you for your time. For more information, you can contact Dr. Mary Helen O'Connor at the phone number or email below.